A lot of dentists have seen ChatGPT and are thinking, what about AI in dentistry? And to answer that question about the current situation and growth curve of AI in dentistry, we have with us a young, enthusiastic entrepreneur, Dr. Drishti Chopra. Dr. Drishti, after completing her PDS, went to Canada, completed her Part 1 NDEB examination. But due to the COVID situation, she had to come back. She didn't lose hope. She started her own private practice and simultaneously got into entrepreneurial ventures. With 4 years under her belt, she is also one of the founding members of Muskaan.ai. Muskaan.ai is working on multiple verticals in the artificial intelligence sector of dentistry. That includes detection of intraoral scans, radiographic analysis, oral cancer analysis, and other than that, a digital dental virtual assistant. So Dr. Drishti Chopra is in the thick of AI and is going to tell us all about it today. I'm Dr. Satish Kumar, and this is Kaizen Dental. Our aim here is to help dentists succeed. Hi, Dr. Drishti. Thank you for taking your time and joining us today. My first question to you is, can you give me an overview of what the situation of AI in dentistry currently is? What are the things in which we can use AI in dentistry currently?
Yeah, so Dr. Satish, first of all, thank you for having me be a part of your small ecosystem where you educate the community about different spaces where they can take up their practices. Your question, to answer it, I would say first that I would like to draw a stark comparison between the medical background and the dental professionals. What I have seen from a dental professional background, AI is integrated in the medical background in a very authentic way. Why? Because it's very extensive. The medical backgrounds have different specialities of people catering to different diseases. Whereas we as dental professionals, we we're actually multifaceted. We not only cater to the patient's treatment, we also devise a treatment plan, look at the radiographs, and then we also have the hard task of completing the cases for those patients. So obviously, there is an element to time saving and just making our lives easier. How artificial intelligence has incorporated in this is it's like a full-time person or maybe thousands of persons doing certain tasks for dental professionals. Early on, I would say when AI got integrated in dentistry, the first use case was dental radiographs. It is divided into two groups currently. One where two-dimensional radiographs are analyzed, and on the other one, three dimensions like CBCT. Moving on from here, during COVID, we saw the importance of remote screening, which is why a lot of different individuals and companies in the industry have developed image analysis for the images of dental patients that they get. And now we've come a very long way from all those places. We've seen a huge leap forward, and we started talking about more patient education through dental GPT post-COVID era, and maybe also improving the screening of oral cancer conditions in India using artificial intelligence solutions. And I'd like to say that Muskaan.ai is currently catering to all of these parameters.
Oh, that's really great. If one company or one app can solve all the problems. So basically, from radiographs to patient diagnosis to cancer diagnosis, as well as increasing the reach of practices. So basically, Muskaan.ai is working on all these fields. So let's divide them one by one. Now, how can an AI help detect various conditions in a radiograph? What maybe a dentist cannot do? Or how is it beneficial to the patient? If you're enjoying this video, do not forget to hit the like button below because it would show the YouTube algorithm that you like content related to growth in dentistry and will show you more of them.
So, Dr. Satish, what I would say here is that I'd first talk about a broader picture and then talk about my experiences with training our AI models on dental radiographs. So, in our human eye is only able to cater to maybe 6 or 7 different areas of grayscales in a radiograph. And in our general practice, most of these grayscales gets limited. And sometimes because of the busy schedule, certain grayscale areas in terms of radiolucencies or other pathologies gets misdiagnosed. What I found was that last year's World Health Organization report stated that India is the first country for oral cancer. And then we are also in the top 10 countries for worst conditions for dental diseases all over the world. And that is why what is the reason for this is because our professionals are overburdened with a lot of administrative tasks in their activities that they do in their dental offices. AI on radiographs can be trained to detect more than 20 different grayscales, which a human eye cannot do. And I think we are still learning and unfolding about it. So having such a technology that can do much more than what a human eye can do in a very fast-paced environment is only beneficial for the professionals. When I talk about our current state in AI with radiographs, we're detecting more than 15 dental pathologies with some anatomical landmarks on 2 dimensions.
Okay. So basically, AI helps improve accuracy of our diagnosis. Does it improve the efficiency? Does it take a lot of time to do it as compared to the manual method?
Yes, that's a very important question, Dr. Satish, and I think it's coming from your experience. So what Muskan.ai solution can do is it helps different types of dentists running a practice over where there are multiple professionals looking at one radiographs, maybe where the dental setup has more than one dental chair, or even those professionals who are trying to perfect everything. So for those professionals, having a second opinion like artificial intelligence only adds more value to the time that they have on their hands and even improve the quality of care they provide to their patients. Like in the past, we can say that a dental x-ray can show us that there is a caries, there is a loss of tooth, or maybe there is a periapical illusion. What now we can say that there is more quantification on top of it. We can inform the patients that there is maybe 5 millimeters of periapical lesion which is extending near the roots, or maybe quantify it in terms of bone loss also. That is what I say AI in radiology helped create in the industry, and with its extent now being available to the professionals, we can provide a more comprehensive diagnosis which can assist the professionals and inform the patients so that they're much more informed about their oral health and accept treatments about the same.
We know AI is a developing field. Okay. It's been used for radiographs, you're telling me. Right now, even patients can take photographs and try with the initial diagnosis before they even enter the clinic. But how intelligent is AI? Is it as intelligent as humans? Is it more intelligent than us? In what stage of evolution of AI we are at?
So I think, Dr. Satish, this will be every professional's question. There'll be some resistance to accepting artificial intelligence. And I'm very happy that you asked me about it. So I would quantify it in terms of very layman language so that it becomes easy for others to understand also. So you can say that artificial intelligence in dentistry currently can be likened to the intelligence level of an ape. And when I say ape, why? Because AI is actually being trained in dentistry by the humans. So it can never be as smart as a human. What AI will be able to do is remember all the things that humans have provided it and immortalize the human intelligence over the period of time it stays in the industry. AI algorithms can analyze radiographs, aid in treatment planning, and even perform some routine administrative tasks, but they lack the nuanced understanding and adaptability of human dentists. But I believe with the ongoing advancements we have seen in the technology, like just recently I saw Devin and Devika from India are now the artificial intelligence for software engineers. So it's already replacing some of the software engineers' jobs. But what we have developed at Muskan AI is an ethical use case of artificial intelligence to augment the lives of dental professionals. But this is still a long way ahead. I would not say that AI cannot take over human intelligence, but it will come at par with the human intelligence in its due time.
I'm a practice owner and I want to start using Muskan.ai. what is the primary benefit I will get of incorporating AI into my dental practice?
So, Dr. Satish, I would say that Muskan.ai as an ecosystem will provide multiple benefits to the dentists, ranging from patient acquisition through image analysis to making data-driven decisions using AI-based radiograph analysis, having an added advantage of AI over your competition because we are understanding that now the market is getting saturated with every 5 kilometer radius having more and more dental practices being opened maybe in 6 or 8 months' time. It also increases patient education. What I have seen with some of our use cases from early adopters of Muskan AI, anywhere between 1x to 5x of patient education has increased. And then the onus of decision making depends on the patient because now they have to take up a decision based on the information they've gotten, if the dentist is providing them a better solution or not. So I would say these are all the things that AI can do for a dental professional. And apart from this, from the clinical aspect, it can also take up some of the administrative tasks of the dentist, like maybe booking appointments, communicating on with their patients on their inavailability, or having a virtual dentist on board with them 24/7, which is Daisy. So I only see primary, secondary, and tertiary benefits for a dental profession as we go down the lane because the number of professionals have become stagnant, but the population is already surpassed China.
Understood. So you were telling me about Daisy. Basically, it's like a dental virtual assistant. Okay. Now imagine I, in my practice, want to integrate Muskan.ai. How do I go about it? And is it easy to integrate with my existing workflows or my practice management systems, or it is completely different?
So that's a very important question for me, which is why when I was developing solutions alongside my team, Dr. Satish, I found that there are different sets of dental practices in India. So Muskan AI has developed multiple solutions around this to augment the different dental practices. For those professionals who are not currently even using a patient management software in the clinic, now they can use entire Muskan.ai's dental assist app wherein we provide dashboards to understand the clinic's key performing indicators, the PMS, patient management software, which comes along with teleconsultations, augmenting all the information taken up by the patients through image analysis and even the AI-based radiograph analysis. For those dental professionals who only want to use our AI for radiographs as a piecemeal, they can call our API, which is a gateway, which you can integrate it with your current PMS, or you can only use our separate entity as a standalone product. Apart from this, our image analysis is available for the community through our mobile application. It is also available through a web link, which the dentist can integrate on their websites, on their social medias, and we can even integrate our solution in your business account, which makes it more easy and gives you the decision making power here, in which way you would want your patients to interact with you or so and so conditions. So the same stands for Daisy also. It's available as a web link, as a QR code. Even you can call our APIs or integrate it in your own business accounts.
Understood. So there are basically four use cases. One is oral analysis, second is radiographic analysis, third is virtual assistant, and fourth is PMS, that is the practice management software. So I can use the entire system if I'm someone new on board. And if I have one of these, for example, I have the PMS, I can use piecemeal of the rest of the three and then use their web links or QR code and reintegrate that to my PMS system. That's very
Yeah,
useful. What you're doing is you're giving them multiple options because many practitioners wouldn't want to change the entire system, and those who are starting can start afresh and take the whole package. That's a very good advantage you guys are providing out there. But now I would be taking x-rays and photos of my patients and uploading them. Is it ethically allowed? Number one, we are allowed to do it, but is this data stored properly and can my data be misused?
yeah. So I think what you're talking here, Dr. Satish, is about the compliance we have with HIPAA and other regulatory compliance around the patient
Absolutely.
data, which is which is where I would say that Muskan.ai is doing extensive efforts on doing so. Why? Because I am a professional here. Our team is mostly involved of professionals, and we believe that if our data is not secure for patients, a lot of different things can happen around the fraudulent cases, or which we generally see around in the community also. So then data encryption, which is both in transit as well as in rest, that will only allow authorized individuals to access it. We perform extensive data encryption on our end. All our services are end-to-end encrypted, meaning we remove personally identifying information from the data sets which we use for training our models. And when I say training the models, most of our companies providing OPGs and CBCTs, they add the patient name, age, their mobile information, and even their email IDs in the report that we get from the radiological center. So we completely remove all those conditions from our analysis when we are training our models. Apart from this, we also ask the professions to maintain transparency with their patients regarding the use of AI technologies. You inform the patient that none of these patient data can be used by our AI model for training, but you also inform them on the go that by taking an informed consent, which we generally take for surgical procedures also. And apart from this, to summarize all of these conditions, none of the patient data that we train on our models is actually being trained by the images that gets analyzed by our clients. But we do ask our clients if they allow us to train our model anonymously for those cases. But we generally do not store these images for training. We only store it for the time being the client is using our services on. Why? Because we are digitizing the records, and if at any point they want an access to their patient data, we provide them through encrypted format. And those are all the conditions we are taking for regulatory compliance, which comes with data protection. And our encryption gateways are very extensive. I mean, as a dental professional, I'm very less informed about the tech stack. So when I saw my team taking so many gateways for encrypting the data, I was very impressed by it. So it's amazing the data that we're doing with protection and even following the regulation for the things that might come in future for Mustani.
Understood. No, it's a very good thing because a lot of people are afraid of exactly this, that their data might be misused. So it is great to know that Muskan.ai is taking care that the data is not leaked and is protected, well protected. Now, if someone joins the Muskan AI ecosystem, okay, and they face some problem, how is the ongoing support in your end? Second, if you all update anything, if there is a next version, because we know AI is continuously evolving. So if there are regular updates, would those be given to already stakeholders, or is that those kept only for the newer clients?
So, Dr. Satish, I think the answer for this is similar for all the other companies which want to establish themselves in an industry and maybe disrupt it. When I say about the ongoing support and upgrades, I really want to talk about here as disrupting the industry towards more democratizing dentistry for affordable, accessible, actionable, and available resources for the community. So we value our early adopters and constantly ask them for more areas of improvement. We would be very happy to know that we even ask our dental professionals that they can even train the model on the way their clinical data looks like. So we have added that feature also, and our updates are constantly updated all over our social medias, even on the dentist's web app. And we also give the professionals, as I mentioned, the right to train the model on the go. We definitely provide technical support. We provide training and education materials to our professionals. We give proactive monitoring and maintenance to them for performance concerns. That also happens on our back end so that none of the client's operations are impacted if there's an issue on our own end. And our team is constantly doing all those things. So that is definitely there. We do all the information relaying to the client very fast pace manner because we want to grow at a very fast pace.
Understood. So that's great. So who are working with you and in your ecosystem currently, they will also be getting the updates. That's a good thing to know. Now let's just forget you're working with Muskan.ai. Okay. And we, as a dentist, I'm asking you this question. We know there are certain things which came in. Out of those, few stuck in dentistry, and the rest were just a hype for time being. Okay. Now, for example, implants have stayed and they've just grown. Whereas on the other hand, lasers came in. A few clinics are adopted it. I'm not saying lasers are outdated. I personally use them. They are amazing, but it has not trickled down to a majority of dental clinics and all are not using it. It's only a select few who are. Similarly, with digital dentistry, which is new, and AI in dentistry. So I want to ask you, what is your personal opinion about the current hype of AI in dentistry? Will it be there after 10 years, or these are just going to be in few clinics and the rest are going to do dentistry as every day?
So, Dr. Satish, I'm very happy that you asked me this question because whenever we go to certain stakeholders whom we want to invest in Muskan AI also, because we really want to do more research and development on our solutions. I get asked this question every time. So, my personal opinion outside of Muskan AI as a professional here is that OpenAI, which made ChatGPT available, was 2 years ago, but artificial intelligence was in the industry since last 10 years. And we've all seen the impact ChatGPT has brought in our lives. I mean, I hear my postgraduate fellow friends from my graduation days who used ChatGPT to make their thesis, even draft all those conditions and everything. And when I talk about this particular use case, I would like to say that AI is here to stay. I mean, if we look at the advancements happening in the industry around technology, like I mentioned again about Devin and Devika, our Indian sister for Devin of Cognizant, all of these companies are developing at breakneck speed because they want to get some skin in the game and they see the value that it will get for redundant human tasks that are generally being taken place. I do not see any of the ethical use cases Muskan AI has developed fade away. I'll be honest with you. Rather, I feel I will get more white and gray hairs if I stay with Muskan AI for the next 10 years because the demand for precision, accuracy towards AI will increase and professionals and our clients will ask newer use cases from us. Maybe we can even develop an artificial intelligence for radiographs for pediatric patients because for them making them understand about their radiographs in a color coded situation which they understand better will improve the case acceptance for them, change the way they behave in a dental setup. Maybe we do not have to use the sodium nitrate laughing gases on them. Why? Because also those things we have to take for patient management for these conditions. So I think we have a very difficult job ahead of us to sustain ourselves and use artificial intelligence in dentistry for the coming 10 years. But I again do not see it anywhere going away. It will only evolve when more difficult conditions will come for us where we have to bring out solutions for the community.
Understood. So if AI is going to be here, okay, and currently it's only in ape phase, lucky for us, do you think it will reach human phase and a lot of tasks done by dentists, maybe diagnosis, consultations would be out, or eventually maybe there will be a robot who would be treating patients? What's your opinion on that?
So you, I'm just going to take parts of your question and answer it because if I talk about it on more, it's a very interesting topic for me. And we can talk about it for hours or maybe days. So you mentioned about robotics. Robotics is already come to dentistry. There are few countries like USA and Europe which are already using robotics for implant surgery for the precision with which they place an implant in all those conditions. I believe the idea of AI replacing dentists is a very intriguing concept. Why? Because it raises questions about the future of technology and healthcare. While I may think it seemed very far-fetched for AI to take on the role for of a patient in a physical sense, but I think with the technologies and the advancements which are already happening around humanoid robots, I mean, I'm pretty sure we all know India has also developed a robot which is going to send out in space and see how it responds like. But I think we might develop some sort of a human form in of AI in humanoid form, but it will definitely not have the subjective perceptions that are integral to the human beings or available in form of healthcare processes. I think AI will likely continue to complement and support healthcare professionals in providing personalized and empathetic care to patients. Um, Before I end my answer to this question, I was just recently on LinkedIn and seeing that in Japan they've already developed an AI related human child form to educate the patients, basically the pediatric patients, how to perform when they sit on a dental chair. So I mean, I see a lot of different things happening around AI, but I do not definitely see patients form coming into real form via artificial intelligence. It's definitely something I cannot wrap my head around. I'm really
So,
excited to see what the community has to say about it, though.
so you're for sure for now that dentists and young dentists are safe and they will have job opportunities?
Definitely. I mean, that's a very interesting way to look at things. Continuously, I get so many emails and e messages in my DM on social medias or even on LinkedIn asking why you're making so and so situations. It's already difficult for us to sustain ourselves in the community and so. But I always tell them that to my fellow dental graduates that our company is doing two things for you. One, it's creating new opportunities for you in terms of job. Why? Because we're constantly asking interns or dental professionals or even postgraduates to reinforce or supervise the model for the things that it has already developed so that when the production team starts working on it, start using their AI algorithms in tweaking certain conditions, our job is done. So AI brings jobs definitely, but apart from that, these professionals can even use Muskan AI as a resource tool to make themselves stand out among the competition. There are seniors in the industry who have their clinic running from a longer period of time. These professionals can open up their own clinic and use Muskan AI and in this saturated profession to sustain themselves because the patient's trust can only be improved with artificial intelligence logic which will educate, inform them about the dental health more appropriately. And Muskan AI can do so for them. I always tell them that you have good things coming for you, use our services, and it's an interesting thing for all our professionals. Not we don't just see the patient's mouth, treat them, and then go back home and lay down. So it's very interesting to integrate technology in this because it saves a lot of our time. We do not have our head knocking that okay 35 minutes has already been done on the patient, another 5 minutes and that patient in the waiting room will come and shout on me. So things will get better with integrating technology to take over certain tasks, I genuinely believe.
Understood. My answer to the audience would be you cannot stop change and evolution. You can either flow with the waves or get hit by it. So I think eventually each one will have to adapt. And there was this interesting research which was done. In one case, there was a set of patients who were given the same amount of anesthetic post procedure by a doctor, and an entire set of patients were given the same anesthetic post surgery by an automated system. The patients who were given the anesthetic by a doctor ended up feeling better and said they were having less pain, whereas the same dosage given by an automated system, the patient said they were not as much as comfortable. So empathy is something which, at least for the near future, I think AI wouldn't be taking off. So anyone interested in AI should get into the AI bandwagon, try and research it. Others should learn to implement it. So now we're done with the jokes part of it. The serious question: if someone wants to implement AI, takes our entire podcast seriously, what would be your advice to them?
Uh, Difficult question for me. I mean, I was having a good time, but I believe these are all important questions also. So I would say to our professionals that you adopt AI, Muskan AI primarily early on, and see the benefits of using AI for more patient education and less burnout for dental professionals because we're all overloaded with a lot of different administrative tasks in our business. So I will personally say that you will love the way you work with AI and it will definitely improve the return on investment Muskan AI will bring to your profession and to your business. So my advice is always the same. You adapt a newer technology early on until and unless others have adapted and you do not have trying to sustain, or maybe your backs get hit against the wall because of the rising healthcare costs and low performance of your operations. So adapt Muskan AI early on. Reach out to me on my LinkedIn, on my social medias, or just drop us an email on info@muskan.ai, and we will help you out in understanding what Muskan AI can do for you.
And we'll be tagging their Instagram page and all other details in our Instagram post. So anyone who wants to contact them, please feel free, go and check that out and contact them. They're extremely helpful. I've spoken to them on over the phone, and they are always willing to and help you join the entire ecosystem and use AI to the best. Uh, Before we end, what is your vision for Muskan AI in the next 10 years?
Oh, next 10 years? Wow. Let me, okay. I mean, I will just say the things that have come on top of my head. So I really want to see myself working on Muskan AI firstly for the next 10 years. And then I would say that maybe Muskan.ai becomes the biggest company empowering dental professionals in and around the world with ethical solutions. I see every dental professional in India using Muskan.ai, being able to digitize their dental records, use less papers, and that is maybe around India. Is I'll talk about India first because it's a made in India solution. I see more unique solutions brought out for artificial intelligence in dentistry with more pressing issues by solving them, maybe like automating the treatment protocols or automating the case recording or even having an AI recording the dentist's or a patient's conversation and making an entire solution on top of it. I see dental care becoming more accessible, affordable, accurate, and actionable around the world and in India by Muskan AI. The more important thing I think I see is Muskan AI being able to decrease the oral cancer burden in India. And maybe we also rank at maybe eighth or ninth in the world for oral cancer cases around the world by WHO. So I think with all the things that Muskan AI is currently doing, provided the community accepts, embraces, adopts Muskan AI, ask me question about it, or ask pressing or difficult questions like you've asked for the next 10-year vision, I think it is possible that Muskan AI becomes a big company with the support of the community. But we also solve some of the most pressing social issues that are present in India because of the dental diseases. So I hope I achieve some of those things in the next 10 years. But the entire ball is in the game, in the hands of our professionals. If they adapt us, we can do it together. I cannot do it alone. So definitely, I think that is one thing I see myself from Muskan AI doing in the next 10 years.
I think you'll surely get a lot of support because what you're doing is visionary and is the need of the hour. And that is the direction in which dentistry is eventually going to go. So I'm sure a lot of dentists would join you in your mission in making India stand out when it comes to AI in dentistry. Thank you, Dr. Drishti, for taking your time and joining us today. It was a lovely conversation, and I'm sure the audience here would have got a lot of idea about how AI in dentistry is currently at and what the future beholds them. Thank you.
Thank you, Dr. Satish. I would also just wanted to thank you to spare this time from your busy schedule to talk about Muskan AI with no hidden agendas underlying it. We just serving the community with better solutions. And as dental professionals, I genuinely believe if we can impact more lives with technology, then I think it is the right time to adapt it. Thank you so much again for letting me and my small vision, Muskan AI, come on your prestige stage like Kaizen Dental. I'll be honest, when I cleared my NDEB, I was only able to do it because I was motivated by the videos that you created for the community. But because of COVID, things didn't happen in my favor. So I don't have any issues with all the things that has happened in the past. My vision is very clear.
Thanks a lot. If you like this video, do not forget to check out these two videos. I'm sure you'll enjoy them.